research has not shown a connection between testicular cancer and any particular habits, activities, or lifestyles. We do know that testicular cancer is almost always curable if it is found early.
That's right, Joe. If a man has testicular cancer, it is important to find out the extent or stages of the disease. Staging procedures include a thorough physical exam, blood tests, x-rays and scans, and in some cases, additional surgery. In our second segment, we'll examine risk factors and treatment methods for testicular cancer.
I don't have a family history of cancer. I don't have anything that you would look for normally in a medical history to indicate any increased risk for cancer or testicular cancer.
There is no known genetic risk for developing testicular cancer. Individuals with family members affected by testicular cancer are not known to be at a higher risk of the disease. The primary risk factors for testicular cancer include undescended testicles at the time of birth and young age. Aside from that, there are no known environmental toxins which have consistently or reproducibly produced testicular cancers.
First couple of days were kind of scary because I didn't know what to expect. You know, you hear chemo and everybody thinks, you know, you'll be throwing up, you'll be losing your hair. I mean, I didn't have such a bad reaction to it. I did lose my hair. You know, I was getting, I had a very large appetite. I did gain some weight. But after, you know, the second or third cycle, it's just get it over with and do what you could do.
This is a typical room. You can close it for privacy. What's here is the patients are brought down. We show them the room before they're going to be treated. And then the patients are shown that they'll have an IV. They'll be hooked up to a pump, and we'll start an IV. Once the IV is in, the patient is told they can walk around until they have the chemo hung. And when the chemotherapy is hung, it's just hung right into this little piggyback here. It's totally painless. When the person is receiving the chemotherapy, you don't notice anything different. And then at night, when it's all finished, we just give them, make sure they have our number to call us if they have any problem.
It wasn't as rough as I expected it to be. I expected, you know, to be a lot sicker than what I actually was. Basically, it didn't stop me from doing any of my daily activities. Chemo lasted me about 15 weeks. Then a month after the chemo, or not even a month, it was maybe more like 2 weeks, I did the lymph node removal, dissection, and that was a week and a half ago. And I'm here now. Biopsy results came back negative, so everything is great.
I had my physical this year, I had my checkups this year, and nothing had shown up at that time. But in the, I guess, 8 months since then, this had progressively gotten larger. I went in initially to the emergency room on a Tuesday. And I actually came then to NYU on a Thursday for a second opinion, just to clarify and make sure that we were doing the right thing. The following Friday, I had an orchiectomy to remove the right testicle. And that was now about 3 weeks ago. In about 2 more weeks, I'll be going in for another procedure to remove about 20 lymph nodes to try to make sure that it hasn't spread at all, and to hopefully avoid having to go for the chemotherapy.